everyone, and welcome to the SavvyCast. And if you are watching on YouTube or listening on the podcast audio, welcome. And I'm so glad you're here. My guest today is part of the family. He's my son-in-law, so I'm super excited to have him, Shawn Hiller. Hey, Shawn.
Hey, what's up, Jamie?
Okay, we are going to talk about something that I think everyone, if they're not in physical therapy, they will eventually be in physical therapy. I'm currently in it. My husband has just come out
Yeah.
of it, but my son-in-law, Shawn, is a physical therapist and he has his own business. It's Vulcan Performance. And there's just a lot about physical therapy that I think I misunderstood until I had a son-in-law who could help me understand things better. And I'm definitely at the age 50s where I'm having to have more physical therapy. And that's just part of growing older. And I'm very thankful, as he's saying, that we've got a son-in-law who can walk us through the things that we're going to be facing. So, Shawn, thank you for coming on. And can you just start by just giving us a little info about your particular business and your approach to physical therapy?
Absolutely. Thank you for having me on. I love the SavvyCast. I'm a longtime listener of the SavvyCast. I love
Awesome.
it. But yeah, so my company is called Vulcan Performance Rehab and Recovery. And everybody has had some type of run-in with physical therapy, whether that be a good or a bad run-in. Well, what we've tried to do with Vulcan Performance is take all the good that we've experienced and really what we believe is the value that people should receive when they go to physical therapy. We've tried to put that into one package. And what I mean is we don't really waste people's time with things that don't really work. There's a lot of that out there where you go to physical therapy and you receive heat, ice, maybe even some ultrasound, things of that nature. And all of those things alone have been shown not to work at all. So we don't use a whole lot of that in the clinic. We're very one-on-one based. A lot of times if you go to physical therapy, you'll be one of 3 or 4 patients in there with the physical therapist, or you may be passed on to like a physical therapy assistant or something of that nature. We only have doctors of physical therapy and we're entirely one-on-one. So when you come in, it's just you and your PT. And that's really the way we believe it should be, because that's the value that people deserve. And some of the things that we're seeing are very, very complex. And if we're just spending 10 to 15 minutes with someone and then passing them off, we're never going to get down to the issue. So we really try to put all of that into the nutshell that is Vulcan Performance, and we address everything. We address nutrition. You know, Ellie, she runs our nutrition side of the company. But even if you don't work with Ellie, we still address the basics of nutrition because that is the building blocks for your health.
And I will say for those, because everyone may not know, Ellie is my firstborn twin who married you, and she is a registered nurse, but she now is part of Vulcan Performance as a certified or registered nutritionist.
She's a nutritionist. Yes, she's a certified nutritionist.
And y'all work together. And one of the first things you told me when I started my physical therapy, this particular round, is that I was not drinking enough water. And I know that that is extremely important. So yes, I do believe all of that goes hand in hand. So you have Ellie and you do address all the facets of the person that you're working with.
Absolutely. When people come in, we have our 5 fundamentals of health. They believe everything that touch on every piece of the health you have. And those 5 fundamentals are nutrition, sleep, exercise, mindfulness, and purpose. And all of those 5 areas have to be addressed to really meet a physical need. And that's important. So we try to do that with everyone who comes in. We try to talk about what are those 5 fundamentals? How do we take the low-hanging fruit pieces like hydration or protein? And then after we take the low-hanging fruit, then we can get into the nuts and bolts and the details of what is happening. And that's really what we try to do as a company is our phrase is enhance what moves you. Whatever it is you're trying to do, whatever life you're trying to live, we want to be able to help you to live that life, whether that's rock climbing or Pilates or doing something else. We want to be your go-to to help you do those things.
Right. Well, and I know this just because y'all are family, but it might be intriguing to those listening. You and Ellie are both CrossFit aficionados, and actually y'all are very active in that. So just briefly tell about that, because to me, that gets into movement and just a whole, which I know you're a movement specialist, but just, you didn't just get your let's say it's an MD, right? When you're a physical therapist.
It's a doctorate of physical. It's a DPT, doctorate of physical therapy.
Okay. But you could get that and
Yeah.
technically not exercise or practice what you preach, but you and Ellie absolutely do. And can
hmm
you just briefly tell how y'all both live what you preach? And
Yeah. So if we're defining what a physical therapist is, it's a movement specialist. That's what we should be. If you're going to a
Mhm.
physical therapist that doesn't understand movement, then I don't know who you're seeing. I don't know what you're seeing exactly, but we are movement specialists. We are engineers of how the body moves. And we practice that. So this weekend, Ellie and I have come off a competition that's called the Mid-Atlantic CrossFit Challenge. And it is almost like the playoffs leading up to the Super Bowl of CrossFit. And
Mm.
we were on a team together, and our marriage has survived being on the team together. So podcast.
Oh,
But
wow.
yeah, we're attracted to CrossFit. We're attracted to anything that is an active lifestyle because that's movement, and we like to think of ourselves as, because we do all these different movements. We do gymnastics, we do swimming, we do running, we do all these different things. We can relate to whatever someone's doing, and therefore help them be able to do that more proficiently and optimize how they do that, because we are the movement specialists. And whether we're seeing someone for an injury that's very serious, they've had surgery for it, and now surgery's over. Now what? I want to get back to what I was doing before. We can
Mhm.
help kind of the kinetics or how the body moves. We can help figure out those kinetics and how can we get you back to that. Or if you're trying to avoid that, how can we make the body move in a certain way to avoid having to go have a very invasive procedure? And that's the biggest thing with physical therapy is, compared to a lot of the things out there, it's conservative. Nothing is entering your body. Nothing's
Mhm.
changing the anatomy of your body. We can keep it all the same. And I tell everybody, there's no reason to walk around in pain. There are too many things that we can do to address pain.
Mhm.
There's too many things, too many ways we can get you to move to change it. So what's the worst thing? You try physical therapy for a little while and nothing changes. Then you have the surgery you were planning on anyways. We can avoid a lot of those surgeries simply by trying to. And I think that's a lot what people don't realize is some of these things that we think are surgical really are not. We can address them.
Now, if you have a personality like I do, and some people do, you want to go quick fix.
hmm
Well, let me just go get a surgery and be done with it. But what you're saying is, there are a lot of surgeries that promise but don't deliver, and that it's also a choice that we need to make for our bodies, the best of our bodies. That hey, there are not always quick fixes. How do you
Yeah.
address that?
Yeah. So first off, too, if you're looking for the quick fix of surgery, what a lot of people don't understand is that after surgery, you need to go through physical therapy. So you were going to do it one way or the other. And there is a time and place for surgery. I'm not hating on surgery. There is a time and a place for it. But a lot of the surgeries that people have, we believe, and we see it all the time, people avoid it. We can avoid it. In fact, two most common surgeries, a knee scope, where they go in and they just kind of shave off some of the meniscus or clear up what's going on in the knee, and then a shoulder scope. They're basically taking a microscope into each joint and looking around. But normally when they do that, they shave off some of the aberrant things they find. They're the two of the most common surgeries out there, and research has proven that long term, a year down the road, you're actually worse off, because when a scope enters your body, depression increases. People are 44% more depressed after that happens. Just we have weird things like that because the body's not ready for it. So we can avoid a lot of those things. We can help avoid these surgeries that are not only extremely costly, it's expensive to have surgery, but also we can help the trauma of the body. You don't have to go through that. We can avoid it. So yeah, whenever we're talking about what are your options, you can go have a cortisone shot, which is what do those do? Those just mask pain. Pain is just a symptom. Pain is not the core issue. We need to address the core issue to make the pain dissipate. But just treating the pain is not going to do anything. It's going to give you a short-term solution for a long-term problem.
Okay. And I will say, I'm probably like most people, I will be driven to PT by pain. Is
100%.
motivated when it's, well, let me, avoid a surgery or whatever. But I now that I've been educated by you, I do think that way. But I currently am seeing you because I let something go to the point where now you've told me it's been going on so long, I'm going to have to take a little longer.
hmm
What would you say to someone maybe who's out there and they're not really thinking about a surgery, but they have a pain
hmm
like mine is in my neck? So I literally wake up all during the night with the pain. At what point should a pain send you to a physical therapist to prevent having something worse once you finally decide to get there. And let me just say, most people are wondering, will insurance pay for it when it's a small problem that could lead to a bigger problem? Because I know that does drive a lot of people, whether it will be paid for.
Yes, we'll address the insurance first. Yes, insurance will address it. If you have, it's not stingy in those regards. If you have an issue, insurance will address it. All we need in Alabama, all we need is a doctor to say yes, you need physical therapy, and then we're good to go as to whatever it is.
There's
We
not
have
a
lot of
cap
people-
on that.
Everybody's insurance plan is different, but as far as starting that process, yeah, there's very little red tape to start that process. Insurance will cover physical therapy as long as the doctor says it's needed.
Oh, great.
Yeah, and second off, so your first question, when should you get physical therapy? I can give you the science behind. We have a scientific answer for that. And so if you have like a neck, something pop up, and say you've been dealing with it for just 1 day, 1 or 2 days, it's not going to hurt you to sit there and say, unless it's terrible pain, to sit there and say, I'm going to see how this turns out. I'm going to try to address it myself. Give it a couple of days and see what happens. But we know the tissue healing factors. We know the timetable for tissue healing. So, for instance, an acute injury is 1 to 3 days. A subacute injury is 3 days to 3 weeks. And then a chronic injury starts turning from 3 weeks to 3 months. Anything past that ends up turning into a chronic issue. So around that subacute stage, that 3 days to 3 weeks, the symptoms you're having then, the painful symptoms you're having aren't necessarily coming from the issue. So so for your issue, it's not necessarily coming from the neck, meaning the painful neurons that are firing, the nervous system that's firing isn't entirely coming from the spot. It starts to become chronic. And chronic pain never reaches the brain. It's actually reflex pathways. So the longer you let this issue persist, the longer it becomes something that isn't musculoskeletal. It isn't a muscle. It isn't a bone. It's the brain. It's the nervous system. And we really don't, when things get to that area, there's a lot of other factors that come into play other than just, I hurt my shoulder. Now it's time to work on it. And now it's, I've hurt my shoulder and my brain keeps sending, or my nervous system keeps sending these painful symptoms to a place that may not even be injured anymore.
So yes. It pays to get help, get things addressed early on.
Absolutely. I'd rather something comes on early on, go to a physical therapist, come see us for a couple of sessions and let's take care of it. Or if you wait 6, 7, 8 months and this thing has become very chronic, you're looking at a longer process. A lot of times people have an issue that's been going on for years and they expect it to clear up pretty quickly. And it's just not tangible. We have to go through a lot of psychological changes before we can really meet the need of getting this pain to go away and allowing you to return to whatever function you were doing before. Yeah, so just tissue healing factors. We know if you have something that's staying around, that's sticking around for about a week, I would go try to deal with it before it gets out of hand.
Yeah. Wow. I wish I had done that because wow, I've let something go on way too long. Okay, so why would just a little snippet, other than pain, what are the things that should make someone consider seeing a physical therapist?
You are limited somehow. So maybe you've been doing Pilates. Okay, you're going to Pilates and you're trying to get into like a cobra pose on the reformer or something of that nature when you're using bands, and you can't do it. It's different than how it was before. Maybe you don't have any pain with it, but you've noticed that you're limited. There's something limited with it. Okay. That's a reason. Or when like people have a limp a lot of times when they're walking and there's no pain with the limp, that limp is there for a reason. And if it's not addressed, something's going to come up from it. If you're limping, the body is out of whack somehow. So like a movement restriction, if you're trying to take both shoulders overhead and you can't get both arms overhead, only one of them goes, but you don't have pain, there's something going on there. And odds are you're going to hit something in life that causes pain to happen in any type of restricted area. So that's a good reason. Maybe you don't have pain. Maybe you have just some kind of weird feeling. It's not going to hurt to come in, let us see what's going on, address it, and then send you out the door. And we've prevented it. We've prevented the issue from happening. Or maybe you're about to have surgery. Maybe you are going to go have a shoulder debridement or something like that done. Well, we can do pre-therapy, prehab, and you can come and we can work on it. We can strengthen the area, make it as strong as possible. And the stronger you are before surgery, the better surgical outcome you're going to have. And we do that a lot where somebody's about to have some type of surgery, like a total knee or something of that nature. and they come in and we just get them as strong as they can be so they can dominate the surgery that they're going to have. Those are some reasons that people would come in other than just having pain.
Okay. So tell us what PT is and what it is not.
PT is the science of using all of those, whatever's appropriate, to get your body the most functional and to be the strongest it can possibly be. PT, physical therapy, is the game plan to enhance your movement.
Okay.
So we find the limited movements, whether they have pain or not, and we set up the game plan to address those limited movements to make them unlimited or functional, return them to function.
Is it different? I know it is different from chiropractic. And if
Mhm.
someone said, I really want to go see a chiropractor because I want to be adjusted, how would that be different from going to a physical therapist, or are those
So
sort of intertwined?
yeah, they're just different methodologies or different approaches. I know some great chiropractors who I'm actually referred to, and there's some. It really depends on the medical label to it. So, like the label of what you do in the medical profession. I'm not big on labels. I'm really
Yeah.
more about how the person practices. So I
Mhm.
would I would think that a chiropractor that is following the research, is practicing the way that we know we should practice, would look similar to kind of how we're doing it, kind of how we do in physical therapy, with a few different nuances, a different philosophy, different things of that nature. But it's still, at the end of the day, it comes down to how well can we get an area to contract and how well can we get the area to move. And so things like being out of alignment, some typical terms that you hear, it may not be as much about being out of alignment. It's probably more about the areas is not moving. We're trying to create movement. So if you go to a practitioner, whatever that practitioner is, whether chiropractor, physical therapist, doctor, whatever they are, if they have one trick, whether that be back popping or manual therapy, and that's all they ever do, then you're probably looking at a one trick guy or one man or a one pony, whatever the phrase is.
Oh,
I can't.
one trick pony, one trick
Yeah,
pony.
yeah, yeah, one trick pony.
Yeah.
Whatever it is, if
Yeah.
that's all they do, then your issue is probably not getting addressed. They're probably throwing everything they have at it at one time, and they're not using all the other tools that we have to address something.
Got it. Okay. Now, why, if I have something that's bothering me and I've not been to see you or anyone, but it's a pain,
Hmm.
why would I immediately choose physical therapy over maybe going to the doctor and maybe getting a shot or taking some pain meds or a muscle relaxer? Let's just say, I know Zane occasionally, before you were in the family, would get some back pain. He would call his primary doctor, our internist, and he would, get some sort of medication for it. And then if
Hmm.
it persisted, but how do you differentiate between?
Absolutely. So, first off, medication, muscle relaxers, painkillers, pain shots, things of that nature. They're only addressing pain again. And we've already talked about pain is not the core issue. Pain is a symptom. Pain's the reason why you're coming to see a physical therapist for sure. But pain is just a symptom of a core problem. So we've got to address whatever the core problem is and let that be the thing that dissipates pain. But I will say this, and we kind of touched on this a minute ago, but if you're not sleeping, if you're not sleeping very well, that's probably a good time to take something to help you sleep, but take the minimal effective dose that allows you to sleep, because while we're sleeping our body secretes 75% of the human growth hormone that we secrete throughout the day. And if we're missing that big chunk of human growth hormone, then that's pure recovery. Our body has no way to rebuild if it's not having that hormone secreted throughout the body. That's where all of our testosterone comes from in men and women, and that allows us to recover. So if you're not sleeping, you can take something, but just remember, whatever you're taking it's affecting pain, and pain is only a symptom of a core
It's
problem,
not
and the problem
healing
has to be
anything.
addressed.
It's just making you feel
Yeah,
better, but the
you keep
problem's still there.
exactly. You're putting a band-aid on something that's going to come back. So
Okay.
short term.
Okay. Um, can you talk about invasive versus non-invasive? And I know physical therapy would be probably the most non-invasive thing you could do for pain.
Hmm.
But then why, again, there are some people who they're willing to go invasive for a quicker fix, but just sort of give your perspective on that.
Yeah. So think about anything you do passive versus active. You can just use common sense here in everyday life. If you're passive about something, if you're not really putting a whole lot of effort into something yourself, how many times do you get a good result from that? You really don't. It takes work. Anything worthwhile takes work. So, and that's kind of what we're getting to. Like pain medication is very passive. Something is literally changing the chemical and hormonal and immune response of your body just to treat a symptom. Pain shots are passive. You have a chemical entering the body to treat a symptom. Surgery is passive. It can be life changing. It's altering the anatomy of your body. It's extremely invasive and changes the makeup of your body forever. After surgery, your body will never be the same. The anatomy is different. How the body codes things is different. Like a non-traumatic meniscal tear, knee debridements, some type of, type 2 labral tears, shoulder impingements, surgeries for those things, they have no better outcomes than sham surgery. Like the sham surgery, just cutting open the body but not doing anything, they have no better outcomes. So if you're thinking about any of those surgeries, you've got to take that into account. Like this is no better than placebo. They could
Now,
cut
for
you up. It could be a
what
pill.
what surgeries did you mention?
Things like meniscal tears, going in and removing the trash out of the knee.
Which
Type
Zane
2
had
labral
he had
tears.
that done before you were in the family, and yeah.
Yeah, I remember.
And he's
I did.
had you've been doing physical therapy, or you
I
did it.
saw him for the knee.
Yeah.
Yeah, later
Yeah.
on.
Oh,
They're
okay.
they're no better than placebo surgery. And some
Wow.
people have good results from them, but again, are you having good results from a surgery or from placebo? So we want to avoid things like that. We
Yeah.
don't want to have those. We want to have if you're going to have surgery, do your research, talk to a physical therapist, because we have no skin in the game for surgery. Like we see you pre-surgical and post-surgical. We're going to see you either way. So you can get a pretty non-biased answer from a PT, from a physical therapist if they are movement specialists. They know what they're doing. And like another big one is MRIs. Like if you're thinking about having an MRI, there can be a time and a place. Listen, everything has a time and place, like Solomon says in Ecclesiastes. But an
Mhm.
MRI, actually, this is so crazy. They'll take an MRI on 3,000 asymptomatic individuals, meaning people who have no pain, no symptoms. They'll take an MRI, and just on normal people, 72% of them are going to have some type of rotator cuff tear. About 90% of them are going to have some type of disc bulge in their low back, but none of them have pain at all. But all of a sudden, you show these people their MRI results, and 45% start having pain. we
Oh,
that we use a
power of
lot.
suggestion, or
It's mental. We're mental beings. We hear it and we're like, oh no, this isn't good. A disc bulge is terrible. It's like a voodoo phrase, and it really shouldn't be.
mhm.
We A lot of times when we see a disc bulge or a slip disc, herniated disc, whatever it is, it's a term called medicalizing normality. These are normal findings that we're just throwing a medical label on, and it freaks people out. We need to learn. Yeah, so there's like if you have a disc bulge, instead of having surgery and again changing your anatomy for forever, let's work on it. Let's teach the body how to move. Let's strengthen the spine. Let's let this thing heal on its own because it's going to heal on its own. In fact, if the jelly's coming out of the donut, if you have a sequestered disc, those heal 92% of the time without any intervention. So, our job is to help your movement, to help strengthen your movement patterns so it doesn't happen again, but it's going to heal. So, we need to stop throwing a lot of very invasive and body changing procedures, whether that be a pain shot or surgery, whatever it is, to things that are going to do fine either way. And that's something we're really big on, is trying to really dive into the research and let people know these things.
Right. Well, Sean, I know that, and can you just tell us a few of the things that might be considered non-conventional physical therapy patients that you're seeing, and that can be treated and can benefit from physical therapy?
Absolutely. So, one of our physical therapists, Claire Bumpers, just got married. I was going to say Claire Reed. She is a specialist in cognitive disorders in the older adult.
Mhm.
So that includes dementia, that includes Parkinson's, that includes Alzheimer's. In fact, we have an entire division of our company is set up to address the needs of the older adults. And in physical therapy wise, we have a whole program. We have a whole Parkinson's program dedicated to this. And it's a very invasive, or not invasive, but it's a very hard program. Like, meaning like we're putting, when you come in for this program, we're going to work. We're working hard. It's a 4-day a week program. It's fully covered by insurance. And we really attack these debilitating diseases that are stopping people from living lives. And what the research says on that, with Parkinson's or Alzheimer's, dementia, they tend to progress at a rate between 5 to 7% per year, meaning you're getting worse. You're getting 5 to 7% worse every year. Well, through this program, through what we know, we can plateau that digression to about 0.7% per year. If we're tying everything together, that can make a big, and over the course of 2 years, you're 10% more, forgetful, or 10%, you have 10% more Parkinsonian symptoms, as opposed to going through this program and putting the work in. Maybe 2 years later, you're only 1% worse. It's a big difference. And so we're really going after those things. And some of the other non-conventional things that I say we treat is, again, movement. If you have a movement issue that maybe you don't have pain, but your movement is compromised somehow, we're movement specialists. We are like called kinetic engineers. We know how to manipulate the body to let it move and do what it needs to be done. And that can be unconventional in thought, but that's the bread and butter of what we do.
So in a nutshell, you would see, or your particular Vulcan performance, you would see someone from high school or even younger, just anyone who would need it, all the way to someone with Alzheimer's in the winter of their life. And you can be beneficial. You can help both ends of the spectrum.
Absolutely. Because like you said earlier, we're not a one-trick pony.
Yeah.
We have a lot of tricks we like to use, and we treat it's the concepts. We treat everyone with the same concepts. We don't like to say that we treat athletes. We like to say we treat everyone as an athlete. And that entails a certain mindset when the person walks through the door. And so whether you're 6 or 96, we can help you in whatever you're going through. And it's the most individualized approach that you will find.
Well, Shawn, just for those as we wind down, for those locally or anywhere near us, you here in Birmingham are in the Crestline, Mountain Brook area part of town, but you also, you have many clients who drive to see you, but then you also have virtual clients. Can you just address how someone could have PT virtually?
Yeah. So if you don't know if you have a good PT, or you're wanting to do something online from your house, or something that's a little bit easier, that insurance will cover that to a certain extent. We have to check out what your insurance is for it. But virtually, we can do things online, and we have a pretty good system for it. It's not just hopping on a Zoom call and I see your face, you see my face, and we're working like that. No, like we're going to set up our screen where we can see your full body. We're going to go through movements. We're going to go through our assessment. And we're going to try to do everything we can. We think we have a really good product virtually for treating the movement issues of the body. So if that is an issue for you, if you can't get to the clinic, then I think it's a great option.
And insurance, many insurances are paying that now.
Yes. A lot of the insurances are paying. Some of them are still hesitant to, but most of them are covering virtual physical therapy if that is something you need. As always, if you are around, we'd love for you to come in the clinic. We'd love just to get to know you. There's something different about being on a screen, but if that's the only option you have, we can do that.
Well, and Shawn, and this might be something for another podcast, which we can do soon, but can you just briefly explain something that I am about to start doing with you and Zane is doing with
Rebecca.
Yeah. And it's something that I think is important to people in my age group who are starting to have injuries, but you want to stay fit, but you're a little afraid of CrossFit. You're like, ooh, I don't want to go hurt myself, or I need to really work out more than I'm working out, but I need hands-on. I need a coach. Can you just touch very briefly on that?
Yeah. So what you're talking about is Master Performance. That is our Master's Performance program. And just briefly on it, Master Performance is an incredibly individualized approach to fitness. And a lot of our folks who are in Master Performance start with us in physical therapy, and then they get into Master's Performance afterwards. But it's fitness. And with Master Performance, we measured pretty much any type of movement measurement or goal that you have, and we set up a game plan of how we're going to reach that goal, and we give you tangible results from it. We measure the cardiovascular system, the pulmonary system, your movement, your mobility, your functional system. We have measures in there that can tell us whether you're 50 years old, 70 years old, 80 years old, however old you are. This is designed with the older adults exactly in mind. This is for the older adult. And in fact, we'll take those results we have and we'll send them to your doctors. So your doctors are seeing the results roll in. They're like, wow, so and so's heart rate was really, really high. We might need to have them in to address this. Or, hey, so and so is doing great. Like, this is awesome. We see they're actually seeing some really positive results from this. And the thing is, we can show you that. It's designed to where you can see your progression. You can see yourself getting better. And we can also read it. And if you do have an older adult that's going through this, we can tell you exactly where they stand with, morbidity, mortality, things of that nature, because these assessments, these quick screens that we use, like the 6-minute walk test, the timed up and go, the 2 minutes sit to stand, those tests were designed to determine just how thriving a person is living, just how well they're living, how well, how poorly they're living. So we can measure those things, and we can, if this person's struggling in this area, our whole game plan is going to be, we've got to get this person better at this so they can live, or get this person better than this so they don't have to go into an assisted living. Get them better at this so we don't have to liquefy our home. So it's really the earlier on we can get,
motivator.
Yeah, the earlier on.
Dang looks like he looks fabulous for his age. You would never think. And then we know the blood work was not great, and you're like, hey, we're about to get started because we want to be around. And that's now I have great blood work, but I need to be doing more than Pilates, but I am afraid of getting injured. So that's why I'm doing it. So
that's a good reason. If we do this assessment and we see the blood markers are out of control, or maybe it's not the blood markers, maybe it is a movement that's an issue, our whole program is going to address that. And then once we get that addressed, we can start spreading out from there. But we got to address the things that are most needed. And that's what we try to do with this.
Yeah. And where I believe, I love CrossFit. I love all the different things, and I'm not taking away from them, but at a certain age, it is worth it to pay for a totally personalized plan that looks at everything. And you can't do that if you're an instructor in a room full of people. That's very hard. So I see such value in that. But well, Shawn, and I would love to share all of the ways to get in touch with you. Yeah. And I know you have a great Instagram. You share on that. You've got YouTube, and people can reach you through your website. So I will put all of that in the show notes.
Awesome.
And if anyone has questions, I'm sure that you're fine if they reach out.
Absolutely. Yeah. Reach out. Anything you have, we'll try to address as best we can.
Awesome. Shawn, thank you for being on the SavvyCast, and I will see you soon.